We described the Hep C life cycle and the mechanism of action of direct acting agents, and we looked at recommendations from AASLD IDSA guidelines for first-line therapy. We evaluated and managed drug-drug interactions, and we designed an individual monitoring plan. Now, given a prescription for Hep C virus agents, provide patient counseling for adverse effects. So in this table, we can see the regimens that are currently available in the US market. You will see that they pretty much all have fatigue and headache listed as common adverse effects, and these are coming from package inserts. And fatigue and headache is most likely due to Hep C infection itself. With second generation protease inhibitors and NS5A inhibitors, they're generally well tolerated. So you will see that for sofosbuvir potassium, for example, headache, fatigue, and nausea. For sofosbuvir potassium oxaliplaravir, similarly, headache, fatigue, nausea, and diarrhea. For glecaprevir pibrentasvir, headache and fatigue. Now, ribavirin specifically has some unique adverse effects, so we can break them into CNS adverse effects. So again, fatigue, headache, but also fever, insomnia, depression, dizziness, and anxiety. There are also some dermatologic adverse effects, such as alopecia, pruritus, and rash, and GI adverse effects, nausea, anorexia, weight decrease, vomiting, and diarrhea. But more importantly, hematologic adverse effects, such as leukopenia, neutropenia, hemolytic anemia, and thrombocytopenia. And this can be pretty severe, especially if you use this in patients with advanced cirrhosis. So decompensated cirrhosis patients typically tend to have low platelets. They may have bleeding issues, GI bleeding. And so the dosing of ribavirin, in fact, is based on the level of hemoglobin. So essentially, if somebody's hemoglobin is going down, as well as platelets, there are recommendations in the package insert on how to adjust dose. And at some point, it becomes contraindicated. Now, there is a black box warning for ribavirin, so hemolytic anemia is a black box warning, but also teratogenicity. So it is contraindicated for use in pregnancy.